Welcome back to our continuing coverage of Hurricane Milton. Excuse me. The storm is expected to make landfall possibly around 9 p.m. Eastern, give or take. Sarasota, the most likely landfall location, although Tampa and St. Petersburg remain in some manner of jeopardy, and that's putting it mildly. It is still a Category 3 storm. That means it is packing winds of about 120 miles per hour. The impacts, varied as they are, of Hurricane Milton, well, they're already being felt on the ground. This tornado, as you can see, spotted in Pembroke Pine, Florida, near Fort Lauderdale on the state's east coast. Many tornadoes have already been spotted. I want to bring in Kimberly Guy, who is the co-chief operating officer for BayCare Health System. The organization has made available 2 of its properties to help with hurricane response. So, Kimberly, this is a moment where things are changing by the moment. What are you hearing? What are you preparing for?
Well, we're preparing for the worst. We're the largest healthcare provider in West Central Florida with 32,000 team members and 16 hospitals, including a pediatric and adult trauma center that we never evacuate and won't flood. So our biggest commitment is to serve this community, and we need to make sure that we have our team ready in-house to serve those that need our healthcare services.
How do you handle the logistics of that, Kimberly? Is everyone basically at those places and ready for whatever comes in the door?
They are. We actually have a storm team and a recovery team. So we have 2 shifts of team who work a 12-hour shift in-house at the beginning of the storm. We call them in, we shelter them, provide food and lodging. And then when we are safe to recover, we send in the recovery team and they replace that team so that we have uninterrupted care the entire time.
You've been through storms before. What are the most typical either injuries or necessities you meet when people come to you seeking care after a storm?
After a storm, I would say one of the most common is injuries where, you know, they've tried to cut down a tree, they've fallen off a roof, some type of trauma from those things when they try to do their own cleanup, perhaps accidents based on debris in the road. Those are pretty much the common reasons they'll come to the healthcare system.
Well, picking up on what you just mentioned, debris in the road, I don't need to tell you this particular part of Florida has debris on the streets in many neighborhoods right now because of Hurricane Helene. That debris is going to turn into one of 2 things. If there's a huge storm surge, it's just going to be part of the sea of things moving around, jeopardizing people who might find themselves momentarily trapped in the water, or before that, whipped up by the winds and turned into projectiles. Does that add to your range of potential dangers for those who might seek your assistance?
It absolutely does. You've articulated that incredibly well. I think the other important factor is our team just went through a really difficult hurricane and the impact of that. And despite that, they're incredibly resilient. They're back at the table ready to serve again. But we do hope that most of that debris got picked up, but it was a pretty short window for us and turnaround for this storm.
Oftentimes in situations like this, there is a request for blood donations. Do you have enough blood or things like that? Do you have all the basics you need for what you think is coming your way in the next, let's say, week or so?
We do. That's part of our preparation. We actually oversupply, bring in stock, making sure that we'll have access, because sometimes you don't have that information, the material access right away after the storm, again, due to debris, down lines, down trees, et cetera, and flooding. So we actually stock up so that we have the supplies that we need. And then we work with our local community providers on things like blood when we need that extra call for help.
Good luck to your team and to the work ahead. Kimberly Guy, thank you very, very much.
Thank you.